Sarcoma is a cancer that occurs in the musculoskeletal system. That is the connective tissue of our body, the things that keep us upright, the things that keep us together.
Like muscles, nerves, or fat, it can be aggressive, it's often misdiagnosed, and it needs expert care from day one. A growing painless lump, deep bone pain, something that's getting bigger, that's not going away, you should get it checked out. Early detection is key.
So one thing that I caution people is if they have a new mass or an enlarging lump on the body, to not dismiss it out of hand and just assume that it is something innocuous or something that's not problematic. It is worth understanding what is causing that process. It's worth getting some imaging of that mass before anybody initiates a treatment plan or does a surgery.
Sarcoma isn't just one cancer, it's 70 different subtypes of cancer. It affects kids and adults, and it needs to be diagnosed early. Sometimes it's misdiagnosed or caught late.
So sarcomas are rare cancers and they're aggressive, meaning they require different treatment modalities and a whole team of doctors coming together in order to treat them in the most effective way. Because they are rare, there are few physicians who are familiar with them and really how to treat them effectively. So you want to be sure you're in a sarcoma center, a place with a dedicated team that comes together to focus on the care of patients with sarcoma. Specifically, sarcomas are treated by medical oncologists, radiation oncologists, and surgical oncologists, also orthopedic oncologists such as myself, with surgery, possibly with radiation, and possibly with chemotherapy. In addition to those doctors, other experts are required in order to give the best possible care, and those are sometimes radiologists who are specialized in musculoskeletal imaging. Those are physical therapists who are used to dealing with patients who have had complex reconstructive surgeries in the treatment of sarcoma. Also, physical medicine rehab doctors who are used to optimizing patients' recovery after surgery, and a caregiving team such as our nurse navigators who are used to dealing with the complex pathway of care that sarcoma patients oftentimes have to walk through.
Sarcoma is rare, about 1% of all adult cancers. It's complex because every tumor acts differently. That's why expertise matters, and you want somebody who is taking care of a lot of sarcomas to take care of yours.
So I rarely receive questions specifically about sarcoma. The reason being is people usually just are not familiar with that disease process. Oftentimes people do have questions about lumps and bumps that they find around their body. And most of the times, these lumps and bumps are benign. These are non-cancerous tumors. But what I encourage people to do is if they notice something, to try to understand it better and not dismiss it out of hand.
One common question that I get is sarcoma hereditary? Most of the time it is not. There are some hereditary diseases that can increase your risk of sarcoma. Another question that I get is, can it come back? Yes, it can. That's why surveillance matters, and we need to follow these things, sometimes for years. So people are told it's a lipoma, a hematoma, or a sports injury. If it's not going away, if it's getting bigger, push for imaging or just come see us.
At HCA HealthONE, Presbyterian St. Luke's Medical Center, we work with HCA Healthcare Sarah Cannon Cancer Network's Drug Development Unit. The Drug Development Unit has phase 1 and phase 2 trials open for sarcoma patients who have not had success with first line, second line, and more standard treatments. This is a very exciting opportunity for some of our patients who are suffering from some of the most aggressive cancers. The Institute for Limb Preservation at HCA HealthONE Presbyterian St. Luke's is a nonprofit that has been in existence for over 30 years. Its mission is to help patients with life and limb-threatening conditions get through the hardest time of their treatment. It focuses on direct patient assistance, research, and scholarships for people who have suffered from those conditions. It is a foundation that is centered in Denver, Colorado, that can provide assistance for patients throughout the Rocky Mountain region.